I think there are only a few clinics in the world who really know what they are doing. The whole technique comes originally from Japan. Kato Ladies Clinic and other clinics from doctors who originally worked in Kato Ladies Clinic. So there are a few in Japan, 3 or 4 clinics who use this technique. Then there is a famous clinic in Shanghai. Mm-hmm. They work together, or they're influenced with the Japanese. There are 2 clinics in the United States. Mm-hmm. New Hope Fertility in New York, and Life, I think they are called Life Fertility. Frank Yelian is the director in Irvine on the West Coast. Mm-hmm. And that's pretty it. There is the University Hospital in Bern in Switzerland, where I started the whole program. I think we are the only clinic in Europe who really do it on a large scale. There are many clinics who also offer it because it becomes modern now, but I don't really think they know what they do, because it is a completely different way of thinking. Mm-hmm. Let me explain a little bit the history of natural cycle IVF. Mm-hmm. The very first IVF baby in 1978 in London was from a natural cycle.
Mm-hmm.
Louis Brown, yes. Exactly. And what they did at this time was the female ovulation comes when it comes. It is very difficult to control. Mm-hmm. So what they did is they did several urine tests mm-hmm. in the patient, and when they saw that LH, so the ovulation hormone, was going up, mm-hmm. they were planning the egg retrieval. At this time it was still with laparoscopy. Mm-hmm. But this laparoscopy, this egg retrieval, was done in the middle of the night in many cases. Mm-hmm. So they were waiting, they were taking the time, and in the middle of the night they did this operation. And this was not very useful to do it on a larger scale like we know today in IVF clinics. Mm-hmm. So at the beginning of the 80s, there was a revolution. Yes. They invented they used the gonadotrophins and the GnRH analogs mm-hmm. To do these treatments. Yes. And all this medication and all these protocols that we know today were only for one thing: to control the ovulation and to be able to do the egg retrieval during the working hours of an IVF center. So what they practically do is they put the patient on an artificial menopause mm-hmm. using the GnRH analogs, because they block the ovaries. And then they stimulate mm-hmm. with the hormones that the body doesn't produce anymore. Mm-hmm. Then you have your follicles, the little bubbles in the ovaries where the eggs grow, and then you can trigger ovulation and plan your egg retrieval in the morning, that no one has to do it in the middle of the night anymore. Mm-hmm. And now it worked very well for the last 25 years, but it had some problems. The most important problems is that this medication is very costly, very expensive. They have a lot of side effects. You need daily injections for several weeks. Mm-hmm. It has you have severe side effects which are potentially life-threatening, like the ovarian hyperstimulation syndrome. Mm-hmm. And in order to have a good result, you usually put back more than one embryo. Mm-hmm. And this is the main reason for multiple pregnancies, which are very dangerous. In real life, you have under 1% twin pregnancies, and after IVF treatments, the mean twin or multiple pregnancy rate is over 20%. So this is a big problem. In several countries in Northern Europe, it is by law forbidden to transfer more than one embryo. So if you think now, during these 25 years, the laboratory technique has improved so much that now we transfer only one embryo in several countries. Why do we still need so much medication and so many embryos? The most logic way is to go back to a more patient-friendly and a more efficient approach, using less medication, and in the case of the natural cycle, no medication at all. And this is what we did since 2009 in Switzerland. We wanted to find a way to a more patient-friendly approach, to something less expensive. And we tried to find a way to control the ovulation, not with these aggressive medication. And we found 2 or 3 different ways. We tried them and we improved them. And now we would say that the natural cycle IVF that we use is as efficient as the stimulated cycle for much less money, much less controls, much less efforts. And it became so popular in Switzerland that now we are the #1 IVF center in Switzerland, and patients are coming from abroad, from other countries, only for this treatment. And what I do now is I'm traveling to conferences, I'm talking about this topic, and more clinics all over the world get interested and excited and want to know more about this technique. And it was my pleasure to spend some days here with your doctors.
Thank you.
And give you a little bit of my work. And I hope that you find this interesting and that you will develop this natural cycle program here as well.
What about Cato Clinic? How many cycles has this clinic per year?
Cato Ladies Clinic is the largest IVF center in the world. They have more than 25,000 cycles per year, which is, in a single center, half of all cycles per year in Germany, for example, which is a large country with a population of 80 million people.
How many years did you work with natural cycle?
Okay. Everything started in 2008. At this time I was working in Barcelona at one of the largest IVF centers in Europe, and I met a young professor from Bern, Switzerland, who just took over the unit of the university, and he was interested in new technology, especially because in Switzerland the state is not paying for IVF. So there was an interest to find a cheaper kind of treatment for IVF patients. And he asked me if I knew how to do natural cycle IVF. And I said, no, I don't know, but I'm really interested in learning how to do it. Okay, I came to Bern, and in January 2009 I started at this unit. And at this time I started to contact everyone who ever published about natural cycle IVF in the literature. I went everywhere. I went to London, I went to Paris, to Brussels, to Slovenia. I visited many IVF centers, and I had specific questions like, how can I control ovulation? No one could answer these questions. I realized that no one really had an idea about this. And around April I got a little bit disappointed because my list of questions got longer and longer and we haven't started yet. And then I was in New York visiting a friend, and he told me that there is a center which is using natural cycle IVF. So I just went there, I knocked on the door and I said, "Hi, I'm Markus Dr. Nitzschke from Germany and would like to introduce natural cycle there. Can you help me?" They said, "Yeah, please sit down. What do you want to know?" And then they showed me their stimulation protocols. And I saw that these people had understood all my questions and had already answers for it. So I agreed with my professor in Bern that I could stay there for 3 months, and they were so kind to teach me everything they knew. And then I went back to Bern and we started the program with a little bit of difficulties at the beginning, because it is very difficult to just learn something and to introduce it into a new place. But after a couple of weeks we had the first pregnancy, and in a very short time we had the largest IVF unit in Switzerland, and people were coming from everywhere. And this was the starting point. In general, there are 3 kinds of patients who are interested in natural cycle IVF. The first kind of patients is the patient who has not a lot of money to pay for the whole IVF cycle, and who is looking for a cheap alternative. Mm-hmm. So, who's looking for low-cost IVF. The second kind of patient is the patient who does not like the idea of injecting all these hormones, because it is potentially dangerous, potentially unhealthy. Mm-hmm. And they would like to use the natural approach. And the third kind of patient is the patient who had a treatment with the regular stimulated IVF, but was a low responder or did not really react to these medications. And instead of using donor egg, they would use the natural approach, because especially in these kind of patients with a low ovarian reserve, it is much more successful than the stimulated approach. Natural cycle is something for every woman. The young women, they get pregnant immediately. If there's only a sperm or a tube problem, and all they need is just an artificial fertilization of the egg and the embryo transfer into the uterus, then it is the best patient ever. But even for the older patients, it is biologically much more efficient than the stimulated IVF. So a publication shows that if you use the natural egg, which was produced by the body without any medication, depending on the age, and one egg from a young woman under 30 years would get a live birth in over 36%, one egg. And even in the worst group of patients over 42 years, one egg can still give a live birth in over 7%. If you look at the stimulated cycles, in the very best group, let's say egg donors, under 30 years, if they get a stimulation, one egg can give a live birth only in 7% of the cases. So this is a little bit to see the difference, biologically spoken. And I don't really see a reason why a woman who produces good quality eggs every month should use this kind of stimulation. The only exception is when the patient has cycle disorders, when there's no ovulation, for example. Then you need a tiny little stimulation in order to get some eggs. I find that the stimulated cycle is very boring. Everything is the same because everything is on autopilot. The woman is put into an artificial menopause, as I said before, and then you just add the stimulation, you do some controls, and when you have ripe follicles, you trigger ovulation, and 36 hours later you do egg retrieval. Every woman is the same in this case, but it is not in reality. Every woman is different. And if you do the natural cycle, if you don't influence her cycle, you get really into touch with the woman's endocrinology, and you see that every cycle in every woman is different. And this is a thrill. It is really exciting because you get to know your patient, and during the treatment you get better and more efficient with your patient because you really know her. Of course, every thing has two sides. Not everything is just perfect. If you have a stimulated cycle, you always get at least 2, 3, in several cases even 10 or 15 eggs. And you have enough material to work with. If you use the natural cycle, you always work with one single follicle per month. And everything has to be perfect. So you have to get this one egg. And then this one egg has to fertilize, develop into an embryo, and then you have to transplant it. So it is possible, and even not very rare, that you don't get this egg, or the patient ovulates before you want to get this egg, or you have the egg but it doesn't fertilize. So in about 60% of the cases you have a transfer, but in 40% not. And this is a very important point, and the patient has to be prepared that this can happen. If you have an egg and an embryo that you can transfer, it is really efficient, and with one embryo you have the same results like with 2 embryos in a stimulated cycle. But what do you explain to the patient if you don't have this egg? It's very important that the patient understands this can happen, and the patient needs to keep the motivation to go on and to try in the next cycle. The beauty of the natural cycle is that you can have a trial every month, because every month there is a new egg which you can take. And if it doesn't work the first time, and maybe not the second, in the third time you can have a transfer of a beautiful embryo and you get pregnant. If you look at the German IVF register, you have 50,000 cycles per year. So a big database of all German IVF centers. Of course, they only use the stimulated cycles. So the mean implantation rate per embryo is 15%. Normally in Germany you transfer 2 embryos. So the mean pregnancy rate in Germany for 2 embryos is 30%. And in our experience, in our center, if we transfer 1 embryo from a natural cycle, we also have this 30% implantation rate. So pregnancy rate, but it's only with 1 embryo, not with 2. So
Per
it
transfer?
is per transfer.
Per transfer.
In both cases, there you have 30% per transfer. But in the stimulated cycle with 2 embryos, so 1 embryo implants only in 15%. And if you transfer the 1 embryo from the natural cycle, you have 30, but only with 1. So it has the double biological efficiency compared with the stimulated cycles.
Thank you very much.